Hello everyone, this is Dr.Akshata Shanbhag. Today we will learn the comparative study of Bryonia alba. First we will see the sphere of action of this drug. It acts on mucous membrane and causes dryness in the mucous membrane. It acts on serous membrane where it causes second stage of inflammation with effusion and stitching pain. So if there is first stage of inflammation, like if there is redness, pain, severe pain and all, aconite, belladonna, ferrum phos will come. And it has action on the muscles, joints, ligaments, causing inflammation leading to rheumatism. And it has action on blood where it affects its quantity, quality and circulation. Now we will compare the Bryonia drug with the other drugs. So first comparison we will see between Nux vomica and pulsatilla. So Bryonia, Nux vomica and pulsatilla all have one common sensation, that is sensation as of a stone in the stomach. So the difference here is in Bryonia there is thirsty for large quantity of water in longer intervals, while Nux vomica has less thirst and pulsatilla is thirstless. So Bryonia has bad taste in the mouth, while the other drugs also have bad taste in the mouth, but more often they will have bitter taste in the mouth. While Nux vomica you find sour taste and pulsatilla again bitter taste in the mouth. And all the three drugs have nausea and vomiting. So Bryonia you can differentiate, there is excessive dryness of the mucous membrane, and in Nux vomica the discharge is present but has stuffed by feeling, that we call it as catarrh. And in pulsatilla you find thick, bland, yellowish green discharge of the mucus. So in Bryonia you find the modality aggravation on motion, on rising up in the morning, while in Nux vomica there is aggravation in the morning and after eating. So pulsatilla has aggravation in the evening and after eating. Further, you will find gastric complaints from dietic errors, especially when warm weather sets in after cold in Bryonia. So while in Nux vomica they get gastric complaints from continued overeating and inactivity, abuse of drugs, coffee, tobacco or alcohol. While pulsatilla will get gastric complaints from too rich foods like pastries, fat food, ice creams in excess. If they have ice creams little, that will not produce any gastric complaints in pulsatilla. But if they eat ice creams in excess, so it will be counted as rich food. So and they get the gastric complaints. And in Bryonia, diarrhea is found, especially aggravation in the morning on movement, overeating in the hot summer. While in the Nux vomica there is diarrhea, aggravation in the morning from overeating and apt to put on dysenteric type. So we know the difference between diarrhea and dysentery. So when there is dysentery you will have blood mixed mucus. In diarrhea there is no blood present. So in diarrhea, in pulsatilla, their diarrhea will be aggravation at night from too rich food, etc. And it is associated with great rumbling of the bowels. So other differences you can find, Bryonia is easily irritated or angered, and even Nux vomica also is irritated person. So while pulsatilla is very mild, gentle, weeping tendency is found in the pulse. So Bryonia has joint pains which are aggravated on motion, and in Nux vomica also same thing you find. But pulsatilla find joint pains amelioration by motion. So Bryonia is called as gourmand. Gourmand in the sense they eat a lot, anything they want to eat. While Nux vomica is epicure, that is they have specificity in eating. They can't eat few things. So pulsatilla they have aversion to the fatty food. Next difference we find between aconite and Bryonia. So in aconite, hyperemia will be present with congestion or even the chills which is precedes an inflammatory fever. Okay, so even in Bryonia also you find congestion, hyperemia, chills and all, but Bryonia is chosen if aconite fails. Whenever aconite is prescribed and it is not improving, then you can think of Bryonia in that case. So how to differentiate apart from this inflammatory fever? You will find that there is restlessness, tossing about in the bed, full of fears in the aconite. While in Bryonia, they want to stay perfectly quiet. They can be restless, tossing about in the bed by nervousness, yet he is aggravated by motion. And in aconite, he imagines that he is going to die. So while in Bryonia, he has apprehensive anxiety present. So next difference we see between Bryonia and belladonna. So in Bryonia, in delirium, patient jerks his limbs and starts during sleep. He springs up from sleep in fright. Same thing you find even in the belladonna, but you will find it more violent from more cerebral erethism. So in Bryonia you find hasty speech and hasty drinking. So belladonna also has this hastiness. Hastiness is making it fast speaking and fast drinking you find. So in Bryonia, headache is ameliorated by lying down still. So they don't want to move. So if they don't move, then their complaints will be better. So while in belladonna, headache is aggravated by lying down. So in Bryonia, the symptoms are better by lying on the painful side. So in belladonna, it is opposite, where you find aggravation by lying on the painful side. So in the Bryonia and belladonna, both you find the chiving motions of the jaws, and in Bryonia you find dry cracked lips, while in belladonna there is no such dryness seen. Next difference we find between Bryonia and rest talks. So in Bryonia you see restless, yet they are aggravated from motion. So while in rest talks there is marked restlessness. As we know, rest talks will come under the trios of restlessness. So Bryonia is better by nosebleed. So while rest talks also has this amelioration from nosebleed. So Bryonia has a sensation as though a board were strapped tightly across the forehead. So same sensation you will find even in the rest talks. So in Bryonia they will find more frequent constipation seen. So while in rest talks there is frequent diarrhea seen. So Bryonia you will see the tongue coated or dry and brown. So while in rest talks there is dry, brown, cracked, red tip tongue, which we know even in the Viva they will be asking about the tongue of rest talks. Red tipped tongue is the answer. So then we will see the difference you find in Bryonia, Ignatia, Aconite and Belladonna. So Bryonia you see the complaints develop very slowly. They have sluggish mind. So while in the Ignatia there is flitting, intermittent, unexpected complaints will be present. So in Aconite the complaints come on with violence, while in Belladonna you find the complaints come with suddenness and violence. Both you will find there in Belladonna. And apart from Bryonia, Ignatia, Aconite and the Belladonna all are excitable patients, while in Bryonia they have a sluggish mind. Then another difference you will find between Bryonia, Aconite or Belladonna is, so in Bryonia, after taking cold, the complaints feel uneasy the next day. They start sneezing, nose discharge, rawness in the chest comes. Then in a day, pneumonia or pleurisy will start. So while in Aconite you find that before Bryonia these are given usually. So initially first Aconite and Belladonna has to be given, then Bryonia will come. So after taking cold the complaints come in first few hours. So why we choose Aconite or Belladonna? Because the complaints, as we saw in the earlier, there will be suddenness, there will be violence. So you find in the Aconite and Belladonna. But in Bryonia they are slow, sluggish, complaints develop slowly. So they have complaints next day. So they are slow, sluggish, passive, insidious in its approach and progress. you find in Bryonia, while full of activity you see in aconite and belladonna. So next we will see the difference between Bryonia, chamomilla and belladonna. So all three drugs are extremely irritable drugs. So only difference you find here is the complaints begin at 9 p.m. and runs the whole night. So this you find in the Bryonia. So while chamomilla you see aggravation at 9 a.m. and in belladonna there is aggravation 3 p.m. and runs up to the night. So this is time modality difference you can find in the three drugs. So then Bryonia, R-Salve and aconite, as we know these three drugs are the trios of thirst remedies. So in Bryonia you find thirst for large quantity of water in longer intervals, and R-Salve thirst for small quantity of water in smaller intervals, and aconite thirst for large quantity of water in smaller intervals. So this is the difference you find in the trios. So Kent gives some of the food disagreeing constitutional remedies. So like if suppose you have given Bryonia or pulsatilla or lycopodium, so there are some foods which you should ask the patient to avoid because that are disagreeing food to that drug especially. So now here in Bryonia you have to ask them to avoid the chicken salad, vegetable salad or the sauerkraut. So if it is pulsatilla, you should ask them to avoid fat foods, lycopodium, oysters, rustox or calcarea carb, ordinary bath he says. But it is difficult to have, probably head bath could be avoided when a person is taking rustox or the calcarea carb. So if these foods are taken during the treatment, so then that can aggravate the complaints. Then in pneumonia there is a difference between Bryonia, aconite and chelidonium. So in pneumonia with high fever, the liver is involved with fullness, with stitching pain and face is yellow, you find in Bryonia. While in aconite in pneumonia there is high fever with intense heat, great excitement, left side affections will be more, and bright red sputum you will find in the aconite. Chelidonium, same as Bryonia, where you find liver fullness and there is stitching pain and all, but with very severe pain continually going from front to back through the right shoulder blade. This you find in the chelidonium. So next difference we see in the coryza between Bryonia, lachesis and aconite. So in Bryonia, nasal catarrh either has dryness of mucous membrane with hoarseness and sneezing, or more frequently when discharge is thick and yellow. So while lachesis has suppressed coryza but no aggravation from motion or yellow discharge will be present. So there is aconite where you find suppressed coryza due to dry cold winds with red face, fever, etc. So then we can find difference between Bryonia and antim-tart. So in pneumonia you will see the difference. So in Bryonia the pneumonia begins in the nose and runs downwards. So antim-tart it begins as bronchitis and runs downwards. And both the drugs you have sharp stitching pain, high fever with great oppression of the chest. And in Bryonia you find more of Croup pneumonia, while here in antim-tart catarrhal pneumonia where the mucous rails are hurled. This you find more in the antim-tart. So next we will see the difference in the pains. So now in Bryonia you find pleurodynia, aggravation from least motion, and they have short rapid breaths. Why they take short rapid breaths? Why they take short breaths is because if they take deep inspiration they have pain. The pain will be increased. As we know in Bryonia that is marked modality you find in any of the complaint, aggravation from least motion. Then Gaultheria is one drug where you have pain in the anterior mediastinum, and ranunculus bulbosus you find intercostal rheumatism. Arnica, sore and bruised feeling of the chest is seen. Rheumex, pains through the left lung. and Kali carp markedly they have pain aggravation 2 to 3 am, and Asclepias pain in the lower part of the left chest, and Actia racemosa they have pain aggravation in the right side in nervous women, and Trifolium there is hoarseness and choking spells at night with the cough, neck stiffness, cramps in the sternocleidomastoid muscles, and there is amelioration by heat and friction. Then we see the synovial involvement or rheumatic affections in the drugs. So Bryonia you find synovial effusion in the rheumatism, muscular rheumatism with sharp stitching pain is seen. So Apis also has synovial effusion with sharp lancinating stinging pain which is aggravated from touch. Actia racemosa has more of muscular rheumatism. So Actia racemosa acts more on the belly of the muscles, so where there is bulky muscles, so there it acts more. Ledampal has rheumatic or gouty inflammations of the great toe with scanty effusion and tends to harden into a nodule. So Actia spicata has small joint rheumatism. He walks comfortably, but as he walks the joints ache and even swell. Colophyllum rheumatism of phalangeal and metacarpal joints you find more. So Sabina affects the smaller joints with gouty nodes and pain is aggravated in a warm room. Colchicum you find joint pains are aggravated in the evening, joints are swollen and dark red, pains are tearing or jerking pains, superficial pains occur in the summer and deep pains occur in the winter. So Viola odorata is one drug where it acts mainly on the right wrist. So this is the difference you find in the rheumatisms. Then coming to headache, so Bryonia has headache aggravation from any movement, either occipital pain or begins in the forehead and extends into occiput, and early morning aggravation, after anger aggravation, and after from stooping aggravation will be seen. Gelsemium has headache with soreness of the eyes on moving them. Natramure headache which feels like the beating of little hammers, aggravation from moving the head and eyes. Petroleum has throbbing occipital headache, and Carbovage nux vomica has occipital pain with bilious attacks, means they will have GI complaints with the headache. Then we see the breast complaints present in the drugs. So in the Bryonia there is threatening mammary abscess with sharp stitching pains, tension of the breast and swelling of a pale red color is seen. While in Belladonna you find violent pain with the mammary abscess, redness is spread out in radii from central point of inflammation. Phytoloca is another drug for mammary abscess. So when from the beginning of the breasts show a tendency to cake. So when suppuration threatens, then this drug will be useful. When child nurses, the pain goes from nipple all over the body, streaking up and down the spine. There is another drug called as Philanthrium, where you have when pains course along the milk ducts between the acts of nursing. Croton tig is another drug where the pain from the nipple through to the back, and when the child nurses, as though the nipple were being pulled by a string. So this sensation they will have. So another difference you find in the toothache, Bryonia, coffea and creosote. So in Bryonia the toothache of rheumatic origin and comes from cold. There are no signs of decay. There is nerve origin and amelioration by hard pressure you find in the Bryonia. So coffea has toothache in children from decayed teeth with amelioration from holding cold water in the mouth. Creosote has neuralgia of the face with burning pains, aggravation by motion and by talking in irritable people whose teeth decay very rapidly. So one difference in diarrhea between Bryonia and Petroleum, So Bryonia has diarrhea in the morning or in the daytime more because motion aggravates. So at night they don't move, so they don't have diarrhea. If they move, definitely they will have diarrhea in the Bryonia. So while in petroleum, diarrhea only in the daytime, even if he moves at night, still there won't be any diarrhea in the petroleum. Then Bryonia and phosphorus, you find Bryonia there is little short rapid breaths because the deep breathing causes pain. So while phosphorus has great soreness in the trachea, rawness and tightness in the trachea with even suffocation also seen. Then Bryonia and natramure, there is headache in the morning with oily sour sweat on head generally present in Bryonia. So while in natramure there is headache in the morning with oily sour sweat on the face. So all these comparative remedies and comparisons I have taken from E.B. Nash, Leaders in Homeopathic Therapeutics with Grouping and Classification, W. Borick, a Pocket Manual of Homeopathic Materia Medica and Repertory, E. A. Farrington, Clinical Materia Medica, Clark, Dictionary of Practical Materia Medica, J. T. Kent, Lectures on Homeopathic Materia Medica. Thank you.